Health problems related to methamphetamine in Australia have increased over the past 10 years. So too are issues related to emerging drugs of concern. Emerging drugs of concern include new psychoactive substances appearing on the market, such as novel benzodiazepines, novel drug classes that are potentially harmful, such as synthetic cannabinoids, and new formulations of older drug classes for which problems related to their use are emerging, such as fentanyls. Australia's alcohol and other drug telephone helplines offer first-line brief intervention, support, advice and referral to people who use drugs and concerned friends and family members. The helplines answer around 100,000 calls a year. Telephone helplines can reach pockets of the community that other health services can't. They can improve access to care from people living in isolated communities. Marginalised people may find the anonymity of helplines attractive due to concerns over stigmatisation or discrimination, and there is some evidence to suggest that telephone helplines support reduction of substance use and increase uptake into treatment. However, there are limited published guidelines available to telephone counselling services for methamphetamine. As new drug trends emerge, training requirements and resource needs should be regularly evaluated. To address this, we sought to conduct a training needs analysis to identify knowledge and resource gaps for alcohol and other drugs telephone helpline service providers for calls related to methamphetamine and emerging drugs. The purpose of this training needs analysis is to focus the development of educational materials and resources. We distributed an anonymous online cross-sectional survey between October 2021 and April 2022 to helpline staff from the National Network of Alcohol and Other Drug Information Services. These are the Alcohol and Drug Information Services of New South Wales and South Australia, AIDA's 24/7 Alcohol and Drug Support in Queensland, the Alcohol and Drug Support Service in Western Australia, and Direct Line of Victoria. The training needs analysis was based on the World Health Organization Hennessy-Hicks training needs analysis tool. The survey collected data on self-perceived training needs in relation to specific psychoactive substances, caller groups, and barriers to training or accessing resources specific to methamphetamine and emerging drugs. 50 people started the questionnaire, of which 29 completed the full survey. From them, we identified 3 key training and resource needs. 1. Practical, community-informed, population-relevant information for culturally and linguistically diverse populations and Aboriginal and Torres Strait Islander peoples for calls relating to methamphetamine and emerging drugs of concern. 2. Training and resources with a particular focus on families and friends of people who use methamphetamine and emerging drugs. 3. Readily accessible, up-to-date information on new and emerging drugs and treatment of related disorders. The results of this study will be used to directly inform the development of new resources and training. Our next step will be to engage with partners in the AOD sector to translate the results of this study into accessible and useful products to support this frontline AOD workforce. By using a structured approach to training needs analysis and enrolling a national sample of key frontline alcohol and other drug service providers, we also hope that the methods and learning can be used to inform approaches by other jurisdictions. We would like to thank all of the staff who participated in the survey. If you or anyone you know needs to speak to someone, call the National Alcohol and Other Drug Hotline on 1800 250 015.